Assalamu alaikum wa rahmatullahi wa barakatuh. Today I'll be explaining the last two anatomy lectures of this block. So, Bismillah, let's start. For these two lectures, we're going to talk about the blood supply of the lower limb. And just like the upper limb, I've merged the slides together. And there's a summary here for the arteries and same thing for the veins. Just make sure you go over the slides with the red stars like these ones. And they're mostly about the clinical application. So any slide with the red star means it's not included here in the summary, okay? So starting off with the arteries. So first of all, here we're gonna start off with this area. It's not included in the lecture, just to understand, okay? I'll tell you when we start the part that's included in the lecture. First of all, we have here the abdominal aorta. So الابdominal aorta هيجي continuation حقتها. It's coming from the abdomen and it's part of the aorta. It's a branch of the aorta, right? So the abdominal aorta is gonna come here and divide into right and left common iliac arteries. Okay, so we have right common iliac artery and left common iliac artery. Okay, this iliac artery, this is the important part now. This iliac artery is gonna come and continue and then divide into internal iliac artery and external iliac artery. Same thing on this side, of course. تمام يعني anything on this side is gonna apply to this side. نفس الشيء بس I'm not gonna draw them on both sides. So the common iliac artery, whether it's right or left ما تفرق, is gonna continue and divide into internal iliac artery and external iliac artery. Let's start with the internal iliac artery. So here we have the internal iliac artery. What's the origin? We just said the origin is gonna be the common iliac artery. What are the branches? It's gonna give us 3 branches. Here we can see this is the iliac artery, right? So we can see this is the posterior internal iliac and anterior internal iliac. This is the posterior internal iliac and this is the anterior internal iliac. Okay, the posterior internal iliac is gonna give us a branch known as superior gluteal artery. Superior gluteal artery. So the origin for the superior gluteal artery is the posterior internal iliac artery. Then the second branch it's gonna give us is known as the inferior gluteal artery. Okay, so the inferior gluteal artery is gonna come from where? It's gonna come from the anterior internal iliac artery. Okay, so this is the first branch from the anterior internal iliac artery. The second branch is gonna be known as obturator artery. So anterior internal iliac artery gives us 2 branches, which are the inferior gluteal and obturator artery. أما posterior internal iliac artery is going to give us only 1 branch, which is the superior gluteal artery. And all these are branches of what? The internal iliac artery. Okay? Clear. Now let's move to the next part. صح, we said the common iliac is going to divide into internal and external. Let's continue and see the external. The external iliac artery is not really important in the lecture. We don't have to know anything about it. What we need to know is that it changes its name into femoral artery, and this is very very important. Okay, so the external iliac artery continues downwards till it reaches a point here. We're gonna see which point this is, and it changes its name into femoral artery. حلوين. طيب, what's the point where the external iliac artery changes into femoral artery? Let's see the point. The point is between the pubis symphysis. Here we have the pubis symphysis and we have Aziz. Remember Aziz? So we have Aziz and pubis symphysis. If we draw a line here, okay, the line in the point in the middle of the line is going to be known as mid-inguinal point. Okay, so the mid-inguinal point here is the area where the external iliac artery changes into femoral artery. That means الحين خلاص بندخل femoral artery. Now we're going to talk about the femoral artery. The origin for the femoral artery is going to be the external iliac artery, where at the mid-inguinal point that we just said. Okay, so the origin for the femoral artery is going to be the external iliac artery at the mid-inguinal point. Okay, what about the termination? For the termination of the femoral artery, it's going to continue downwards till it reaches where? Till it reaches here, an area we're going to talk about, and then it continues as popliteal artery. Okay, it's going to go backward خلاص posteriorly and continue as popliteal artery. فقلنا أول شيء it starts as إيش external iliac artery, then at the mid-inguinal point it changes into femoral artery, then here at a point we're going to mention which is إيش when it enters the abductor hiatus. When it enters the abductor hiatus it changes into popliteal artery. We're going to see what the abductor hiatus is in a minute. Okay, so for the course, okay, we have two areas where the femoral artery passes by. The first area is إيش the femoral triangle. Okay, so we have here, there's not a triangle but the femoral triangle. Okay, so we have the femoral triangle and then we have here the abductor hiatus. Let's see them in this diagram here because it's more clear. Okay, for the femoral triangle, first of all, here we need to know a very 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 important point, which is إيش vein. Remember here in the femoral triangle we have إيش vein, vein, artery, nerve. Okay, so vein, artery and nerve. And the very important point we need to remember is that إيش the femoral vein is always medial to the artery. Okay, the femoral vein is always medial to the artery, and the nerve, the femoral nerve, is always إيش lateral to the artery. How are we gonna remember this? This is just a way to remember it. Okay, so we always say artery and vein, صح؟ دايما نقول artery vein artery vein. We never say مثلا artery and nerve يعني rarely. Okay, so نتذكر إن artery and vein are always together, for they always meet, right? So they always meet, that means they're medial. Okay, and the artery is like the king. The artery is in the middle. We never say إنه الارtery medial أو lateral. لا, we always say what the structure is according to the artery. يعني we say the vein is medial to the artery. We don't say the artery is مثلا lateral to the vein. لا, we never say what the artery is. The artery is the king. The artery is just there. It's sitting down. So we talk about the other structure. So we're gonna say إيش the vein, the femoral vein is إيش medial to the femoral artery, and the nerve is lateral to the femoral artery. Okay, النيرف بعيدة فخلاص it's lateral. أما vein, it's always together, it's always with the artery, so it's stuck to it, they meet, so it's medial to the artery. تمام? This is the first part that we talked about, which is إيش the femoral triangle. خلاص. The second part is إيش the second part is the abductor hiatus. So we said the abductor hiatus is where إيش it's where the femoral artery changes its name into popliteal artery. So the femoral artery passes by and then enters or passes through إيش the abductor hiatus, and then it goes to the posterior part of the knee خلاص and changes its name into popliteal artery. So we can see here, this is the femoral artery كده continuing. Once it reaches here, it goes into هنا, let's imagine there's the abductor hiatus, it goes into the abductor hiatus and بعدين تدخل here posteriorly in the back of the knee, which is here, which continues as إيش popliteal artery. خلاص, we're gonna talk about the popliteal artery but not now. خلاص, so just let's skip it for now. طيب, بعدين we're gonna talk about إيش branches of the femoral artery. So the femoral artery has 6 branches. We have 6 branches for the femoral artery. We have 3 superficial branches and 3 deep branches. Okay, so for the superficial branches, they're all known as إيش superficial. So the difference is إيش the second name. So let's see the second name. The second name is إيش the first one is the superficial circumflex iliac artery. Circumflex, we know that it's إيش in a circular movement, يعني إنه the artery moves in a circular direction. Okay, iliac, it's gonna go from its name. It's known as superficial circumflex iliac artery. So it's gonna go here and it's gonna go upward all the way to the iliac crest, and it's gonna go in a circular movement. تمام? So this is the first branch. The first superficial branch is the superficial circumflex iliac artery. The second superficial branch is superficial epigastric artery. Epigastric means it's going to the abdomen or the GIT. So this branch is going here upwards, it's ascending, it's going all the way to the abdomen. تمام? So superficial epigastric artery. This is the second superficial branch. The third superficial branch is the superficial external pudendal artery. Superficial external pudendal means it's going to the external genitalia. Okay, so this is the branch here, superficial external pudendal artery. تمام? The second branch that's going to go with the superficial external pudendal is going to be إيش the deep external pudendal. And it's the same thing, بس واحدة superficial واحدة deep. Okay, so we have superficial external pudendal and we have deep external pudendal. So this is the deep external pudendal, and it's also going to go to the external genitalia. Okay, so this is the first deep branch. Then we have descending genicular artery. Descending genicular artery is right here, okay? Genicular means it's going to the knee. So once you see genicular, means it's going to the knee, okay? So descending genicular artery, تمام? This is the second deep branch. The third and last branch for the femoral artery is إيش? The profunda femoris. And if you remember from the upper limb, we had إيش? We had the profunda brachii, and I said it's a very, very important branch. So remember, in a profunda, anywhere you find profunda, that means it's a very important branch. Here we have profunda femoris, and it's a very important branch as well, okay? So كده we're done with all the branches for the femoral artery. Now let's move to the last branch, which was the profunda femoris. Let's talk about it in more details. لأنه the profunda femoris is going to divide and give us further on more branches, which are very important, okay? So the profunda femoris is the one here in blue. Okay, we can see it. We said it's a branch from the femoral artery. So the origin is going to be إيش? The posterior lateral of the femoral artery. خلاص. Specific يعني posterior lateral يعني this is the femoral artery, right? This is the medial part and this is the lateral part. So in the back, the posterior part of the femoral artery, laterally, this is where the branch is going to come out from, okay? Which is the profunda femoris, okay? So this branch is going to go down here and give us further on branches. What are the branches? Let's talk about them one by one. It's going to give us 3 branches أول شيء here, okay? No, wait, here. It's going to give us, let's start again. It's going to descend downward and give us 3 branches here. First, second, third. What are these branches known as? Perforating branches, okay? So first, second, third, perforating arteries, okay? So it's going to give us the first 3 branches, which are the first, second, and third perforating arteries. And you might say, oh, what about the fourth one? The fourth one is not considered a branch. The fourth one is considered the termination, okay? So the fourth perforating artery is إيش? Is the termination for the profunda femoris. It's not a branch. So the branches are the first, second, and third perforating arteries. The fourth one is considered the termination for the profunda femoris. تمام? طيب, what about the other 2 branches? We said we have 3 branches, right? So we have the perforating arteries. This is the first branch. Then we have medial circumflex femoral and lateral circumflex femoral. Okay? Let's see them. Here we have إيش? And medial circumflex femoral is the one in pink. And it's going إيش? Backwards. It's medially. Okay? So it's going medially here. It's going to go, we know circumflex is a circular movement, صح? But it's going to go كده around الإيش? Close to the neck of the femur, okay? So it's gonna go here كده, and this is the lateral circumflex femoral artery, okay? The one in blue is the lateral and the one in pink is the medial. These 2 branches are gonna give us إيش? Further on more branches, okay? So we can see here, and these are gonna give us branches. Let's open the branches here so we can see them next to each other. طيب? So we said إيش? And medial is gonna give us 3 branches. The lateral is going to give us 3 branches, okay? Here we have the medial circumflex هيعطينا 3 branches and the lateral هيعطينا 3 branches, okay? Let's start with إيش? The lateral, okay? So the lateral is going to give us 3 really easy branches: ascending, descending, transverse. Ascending, descending, transverse. Very easy, صح? Ascending, where is it going to go? The ascending is going to go to the iliac, okay? So the iliac crest here. زي إيش? It's similar to what? It's similar to here, the superficial circumflex iliac. Remember the superficial circumflex iliac? It's also going to the iliac crest. So here نفس الفكرة. We have the ascending branch of the lateral circumflex is going to go upwards. It's ascending. It's going to go to the iliac, okay? Then we have the descending. The descending is going to go where? It's going to go to the knee, okay? So the descending is going to go to the knee, okay? Then we have the transverse. The transverse is just here in the middle. We don't need to know where it's going to go. تمام? بعدين we have the medial circumflex. So كده we know خلاص lateral circumflex. We saw the 3 branches and we know where each branch is going to go. What about the medial circumflex? The medial circumflex is also going to give us 3 branches. The first branch is also ascending. يعني عندنا ascending زي اللي قبل شوي, similar to the one in the lateral. The second branch is إيش? Is transverse, also similar to the one we just saw. The third branch is إيش? Acetabular branch. So we don't have descending. في المedial we don't have descending. The difference is that in the lateral we said that the ascending branch is going to go to the iliac, right? Here for the medial, it's not going to go to the iliac. It's going to go to the greater trochanter of edge of the femur, okay? So it's going to go to the greater trochanter, okay? So for the ascending medial circumflex femoral artery, it's going to go edge, it's going to go to the greater trochanter. For the lateral, the ascending branch for the lateral circumflex, it's going to go where? To the iliac. طيب. The second branch for the medial is going to be edge. It's going to be transverse, just like the one we just mentioned here in the lateral. So we're going to have ascending and transverse, same as edge, the lateral. The third branch is not going to be descending. ما عندنا descending في المedial. We don't have descending في المedial. We have acetabular. So we're going to have the acetabular branch. So this is the acetabular branch. It's going to go where? It's going to go around the, it's going to go to the acetabulum, basically, okay? So we have the acetabular branch, okay? So كده we have إيش قلنا? Ascending, descending, and acetabular branch. Here these are messed up, I think. Let's just fix it really quickly. This is supposed to be إيش? The transverse branch. And this is the acetabular branch. يعني number 3 is the acetabular branch, okay? This one right here is the acetabular branch because it's going to the acetabulum. The acetabulum is here, okay? And this is the transverse branch, okay? So I think here it's the same. Yeah, transverse and acetabular. خلاص, we fixed it. So this is the acetabular branch and this is the transverse branch. تمام? كده we're done with all the branches for the profunda femoris. You know, we were talking about the profunda femoris. يعني كل هذول اللي قلناهم, all these branches we just talked about are coming from where? They're coming from the profunda femoris. And where is the profunda femoris coming from أصلا? What's the origin for the profunda femoris? It's a branch of the femoral artery. تمام? So remember, the profunda femoris is going to give us all these branches, which are the medial circumflex femoral, the lateral circumflex femoral, and their branches, which are ascending, transverse, acetabular for the medial, and ascending, transverse, descending for the lateral. And then we're going to have the first, second, third perforating arteries. And the fourth perforating artery is going to be the termination for the profunda femoris. تمام? كده we're done with all the femoral artery and then the branches of it and the profunda femoris. Now let's go back to the termination of the femoral artery. Remember for the femoral artery. Remember the termination for the femoral artery. صح, we said it's gonna go through through the abductor hiatus. Imagine it's here, so it's gonna go through the abductor hiatus, and it's gonna change its name into popliteal artery, and it's gonna go where? Posterior. عند الركبة من ورا. Okay, posterior. So let's go see the popliteal artery. The popliteal artery is right here. So what's the origin for the popliteal artery? We just mentioned it. It's the femoral artery. So the femoral artery is the origin of the popliteal artery. Where exactly? At the adductor hiatus. Okay, this is adductor. Okay, I'm fixing any mistakes here, guys, so I'm sorry. Where is the, here I wrote abductor, but I can't find it now. Abductor, it's adductor, okay? So this is not abductor, it's adductor. So at the adductor hiatus, the femoral artery is gonna change into popliteal artery. تمام? So at the adductor hiatus, the femoral artery is gonna change into popliteal artery. So this is the origin for the popliteal artery. What about the termination? It terminates at the lower border of the popliteus muscle. Okay, we're gonna see it right now. So it terminates at the lower border of popliteus muscle and gives us two branches, which are anterior tibial artery and posterior tibial artery. Okay, so the origin we said is the femoral artery. Plus, once it passes through the adductor hiatus, and it continues as popliteal artery, and then the popliteal artery terminates at the lower border of the popliteus muscle and gives us anterior tibial and posterior tibial. Let's see it here because it's more clear. Here we can see this is the muscle, okay? This is the popliteus muscle. This is the lower border of the muscle, okay? So it's gonna terminate here in the lower border, خلاص, and it's gonna give us anterior والposterior, anterior tibial and posterior tibial. طيب, first of all, let's see the branches حقت الpopliteal artery. Okay, for the branches, it has 5 branches, which are very easy. They're all named after the site they're in, the area they're in. This is superior, right? These two are superior, so they're known as superior and superior. واحدة medial, واحدة lateral. خلاص, so superior medial and superior lateral. Okay, and this is how do we like recognize which one is medial, which one is lateral from the fibula, okay? So once we see the fibula, this means we're on the lateral side. تمام؟ لأنه we know the fibula is lateral. تمام؟ So this is here the lateral side and this is the medial side. تمام؟ So عندنا superior medial, superior lateral. بعدين عندنا inferior medial, inferior lateral. خلصنا 4 branches. One more branch left, which is the middle branch. Okay, because it's in the middle here and it supplies the knee joint. Okay? So these are the 4 branches from the popliteal artery. Okay? Now we said صح, we're going to continue down because the termination حقت popliteal artery is at the lower border of the popliteus muscle and it's going to give us anterior tibial and posterior tibial. صح? صح. So let's start with with the anterior tibial. Anterior tibial from its name, it's gonna go anteriorly, right? So let's go back here and see it. Here we can see the anterior tibial جاي من ورا من هنا. خلاص جاي from the posterior side of the knee. Okay? So this is the anterior tibial. What's the origin? It's a branch of the popliteal artery at the lower border of the popliteus muscle. Same as the termination حقت popliteal artery. تمام? What about the landmark? Where does it go? يعني where exactly does it go? It goes في upper border here. يكون where? يكون deep. Okay? So in the upper border يكون deep. Once we start moving downwards and going towards the foot, it starts becoming more superficial. يعني here, this is from a side view a little. Let's see here. This is like in front of us, right in front of us. So here we have the anterior tibial جاي from the back, from the posterior side, from the knee. It's continuing here, it's deep. But then here it starts becoming superficial. And in the upper part it's deep and then it becomes superficial. تمام? Once it reaches here the foot, خلاص, what happens? The termination حقها, and it changes its name into dorsalis pedis artery. So dorsalis pedis is the termination for the anterior tibial. يعني كان اسمه anterior tibial. Once it reaches the foot, its name is anterior tibial. Once it reaches the foot here, it changes its name into dorsalis pedis. Where did this change occur? When does the anterior tibial تغير عن dorsalis pedis? It happens when the anterior tibial passes through the 2 extensor. First of all, extensor hallucis longus and extensor digitorum longus. يعني the 2 extensors اللي هم muscles. So once the anterior tibial passes through, or passes in between, not through, it passes in between extensor hallucis longus and extensor digitorum longus, then its name changes into dorsalis pedis. Let's see it here in the slide. See? So here, this is the anterior tibial. So here we can see this is the extensor hallucis longus and extensor digitorum longus, and it's going to pass through here in between both of them. خلاص? So the anterior tibial is going to pass through extensor hallucis longus and extensor digitorum longus. And when it passes هنا through them, خلاص, its name changes into dorsalis pedis artery. Okay? Now, let's see the branches حقت anterior tibial. Okay? And then we'll come back to the dorsalis pedis. But let's see the branches for the anterior tibial artery. Okay? For the branches for the anterior tibial, it has 4 branches. The branches are very, very easy as well. They're all named after the side they're in. زي اللي قبل شيء, just like the ones we just saw for the popliteal. Okay? So we have posterior tibial recurrent. We can't see it here because it's from its name, it's posterior. So let's go back here and we're gonna see it. So posterior tibial recurrent. It's posterior, it's going to the tibia and it's recurring. It's going backwards. خلاص? So this is posterior tibial recurrent. تمام? This is the first branch. Second branch is anterior tibial recurrent. عكسه, from the anterior side. So here we have anterior tibial recurrent. تمام? Then we have anterior medial malleolus and posterior lateral malleolus. So anterior medial malleolus, medial we said خلاص, anything away from the fibula is medial. يعني this is medial, this is lateral because of the fibula, right? So here this is the anterior medial malleolar artery or branch, and here this is the posterior lateral malleolar branch. Okay? So عندنا anterior medial malleolar and posterior lateral malleolar. Okay? كده we're done with the branches حقت anterior tibial artery. Now let's move to dorsalis pedis. We just said the dorsalis pedis is it's the termination of the anterior tibial artery. So what's the origin? The origin is the anterior tibial artery. خلاص? What about what about where does it go? And its landmark. In the dorsum here it goes lateral to the extensor hallucis longus. خلاص? Then it pierces the first intermetatarsal space. and forms the plantar arch. This is important, okay? Forms the plantar arch. This is ايش the termination. يعني termination for the dorsal pedis ايش. This is not very important. This is just to like know the pathway of the artery. بس the origin and termination are very important. طيب so dorsalis pedis الترمينيشن حقتها ايش؟ it forms the plantar arch. هي arch. We said any arch is formed by the meeting of two arteries, right? So أكيد it's not going to form the arch by itself. It's going to form the arch with ايش؟ with the lateral plantar artery. We're going to talk about it, okay? But just remember dorsalis pedis and lateral plantar artery both form ايش؟ the plantar arch, okay? Dorsalis pedis and lateral plantar artery both form the plantar arch, okay? We only have one arch in the arteries, okay? Unlike the upper limb, we had many arches. Here we only have one arch, which is the plantar arch, okay? So remember which two form the plantar arch, dorsalis pedis and lateral plantar arch. What are the branches for the dorsalis pedis? Let's see the branches. أول شيء we know this is the dorsalis pedis, the one in the middle. خلاص. What are the branches it's going to give? It's going to give us أول شيء medial tarsal artery, lateral tarsal artery. From its name, it's going to go to the tarsals. So عندنا medial tarsal artery and lateral tarsal artery, okay? Then we have an arcuate artery. The arcuate artery is going to come here. It's going to supply the second, third, and fourth toes, okay? So the arcuate artery is here. It's supply for the toes, تمام? So this is the third branch from the dorsalis pedis. The last two branches are the first dorsal metatarsal artery, which is here. It's going to supply the toe. And then we have the first plantar metatarsal artery. This is from this is the foot من تحت, خلاص, from underneath, okay? So this is the last branch, which is the first plantar metatarsal artery, which is right here. This is the first plantar metatarsal artery, okay? So it comes from here, it comes anterior, it goes backward, moves all the way backward, and come in the lower part of the toe, okay? It supplies the lower part of the toe. كده we're done with the branches for the dorsalis pedis, okay? Now let's move back here. If you remember when we talked about the popliteal artery, we said it terminates into anterior tibial and posterior tibial. كده we're done with the anterior tibial. We said everything about the anterior tibial, and then we reached all the way to the dorsalis pedis, which is the termination حقت the anterior tibial. So let's go back and see the posterior tibial now, okay? So for the posterior tibial, what's the origin? We all know it. It's a branch of the popliteal artery, okay? Where exactly does this termination occur? We said at the lower border of the popliteus muscle, تمام? So this is the origin for the posterior tibial artery. It's the same as the origin for the anterior tibial artery. عندهم نفس الorigin. بعدين landmark. I just said this is not very important. It's important just to understand يعني. So at the lower border, خلاص, here it's superficial, and then posterior inferior to the medial malleus. يعني it moves here كده. It's posterior inferior to the medial malleus, and we know خلاص this is the medial side since هنا الفibula. So الفibula is lateral, so this is the medial side, تمام? What about the termination? الtermination يقول لك عند الفلexor retinaculum it divides into two. Where's the flexor retinaculum? Let's see the flexor retinaculum. Let's see it in this diagram here because it's more clear. So here we have the flexor retinaculum, okay? So here we have the flexor retinaculum. This is the area where the posterior tibial artery is gonna terminate into medial plantar and lateral plantar. Let's see them here from a different view. So here we can see flexor retinaculum is gonna terminate into medial plantar artery and lateral plantar artery. Okay, we're gonna talk about them in details. But for now, just know that they're the termination for the posterior tibial artery. تمام? Now let's see the branches for the posterior tibial artery. For the branches of the posterior tibial artery, they're very easy. Okay, we have a lot of branches, but we're gonna remember them in an easy way. أول شيء, the most important branch is the peroneal artery. Okay, so as we can see here, the posterior tibial artery is medial, right? It's more towards the medial side. So it's going to give a branch known as the peroneal artery. This branch is going to supply mostly the lateral side. تمام؟ فبيطلع لنا branch يسبلاي lateral side, وهو نفسه posterior tibial يسبلاي medial side. تمام؟ So the peroneal artery is going to give us branches to supply the lateral side. And these branches are going to be identical to the branches for the posterior tibial, بس الفرق اللهم إنه these ones are for the lateral, these ones are for the medial. يعني the peroneal artery is gonna copy the posterior tibial artery. It's a branch of it, right? أصلا هي peroneal artery is a branch from the posterior tibia. So it's a branch that's gonna give us further on more branches. These branches are gonna be exactly the same as the ones for the posterior tibial, but for the different sides, for the lateral side, okay? Let's see them so you can understand them more. There's only two exceptions, يعني two different branches. Everything else is the same. First of all, we have muscular, and we know in muscular from the previous lecture we said skip them, they're not very important, so we have muscular, skip them. خلاص? First common, or not common, first similar branch we have is nutrient artery to fibula. وهنا we have nutrient artery to tibia. Why is this the fibula? Why is this the tibia? لأنه قلنا peroneal is going to supply the lateral side. We know that the fibula is on the lateral side, while the tibia is on the medial side. Nutrient artery for the fibula is going to be a branch from the peroneal artery, while the nutrient artery for the tibia is going to be a branch from the posterior tibial artery. Okay? Then we have communicating or communication branches. From their name, communication, same thing. They're for the two arteries to communicate. يعني peroneal artery or tibial or posterior tibial artery have to communicate, right? So there's two branches that allow this communication. So we have a communicating branch from the peroneal artery and the communicating branch from the posterior tibial artery. Next, then we have lateral malleolar and medial malleolar. From their name, lateral means it's going to be a branch from where? From the peroneal. And the peroneal is going to supply the lateral side. So lateral malleolar is going to be a branch from the peroneal artery, while the medial malleolar is going to be a branch from the posterior tibial artery because it's the medial side. Okay, same thing applies to the next one, which is lateral calcaneal and medial calcaneal. They're going to where? The calcaneus, right? So the lateral is going to come from the peroneal artery, while the medial is going to come from the posterior tibial artery. Okay, بعدين we said we have exceptions. We have two branches which are different, right? So the first branch which is different and the peroneal artery is known as perforating branch, which is this one right here. Not very pointed, but it's the different one. Okay, so عندنا perforating branch. أما في posterior tibial artery, صح, I just said that all the branches that are going to come from the posterior tibial artery are going to supply the medial side, while the peroneal artery is going to supply the lateral side. We only have one exception. The exception is the circumflex fibula. Circumflex fibula, from its name, we know circumflex means it moves in a circular movement, صح? وفibula means it's going to the fibula, right? So circumflex fibula is the exception for the branches of the posterior tibial artery. Why? لأنه it's the only one that supplies the lateral side. It supplies the fibula. تمام? So circumflex fibula is right here. It supplies the fibula. It goes in a circular movement كده. Okay? All the other branches supply the medial side. Okay? And of course we can't forget the peroneal artery. It's the main branch of the posterior tibial artery. So كده we're done with the branches of the posterior tibial and the branches of the peroneal artery, which is a branch from the posterior tibial. Okay? And remember, like, compare them because they're very easy, and it's easy to memorize if you compare them because they're almost the same except for the perforating here and the circumflex here. تمام؟ وهي peroneal طبعا. طيب, let's move back to termination. صح, we said for the termination under the flexor retinaculum it's going to divide into medial plantar and lateral plantar. Let's go see the medial and lateral plantar. So here we have medial and lateral plantar. So we said the medial plantar, what's the origin? Both of them have the same origin, which is the posterior tibial artery. But one of them is a smaller branch and one of them is a larger branch. So clearly we can see the medial one is the smaller branch, while the lateral one is the larger branch. Okay? So they have the same origin. But for the medial plantar artery, a really important point we need to know that it's the blood supply for the medial side of the big toe. يعني medial plantar artery is the blood supply for the medial side of the big toe. تمام? This is important to know. The lateral plantar artery, where does it terminate? Remember when we said هنا the plantar arch in the dorsalis pedis, I said the termination that it forms the plantar arch. How does it form the plantar arch? We said that it forms the plantar arch when it meets the lateral plantar artery. So here's the lateral plantar artery. So a termination that it forms the plantar arch with who? With the dorsalis pedis. Okay? Branches are similar for both the lateral and medial. That's why I didn't write them twice, because they have the same branches. تمام. يعني these branches are for both of them, not only for the lateral. يعني the medial also has branches. These are the branches. Okay, so they have muscular branches, cutaneous branches, articular branches. Okay, both of them. Not very important. Then the last thing we have is the arch. The plantar arch is very, very important. Okay, we need to know that it gives us two branches. يعني الarch نفسها, the arch gives us two branches. But before the branches, what is it formed of? We just said it. The plantar arch is formed by two arteries, which are the dorsalis pedis and the lateral plantar artery. Dorsalis pedis and lateral plantar artery, both of them form the plantar arch. So the plantar arch is going to give us, we said, two branches. What's the first branch? Perforating branches. Okay, that's the first part. Not very important. Second branch, which is very, very important, is second, third, fourth plantar metatarsal artery. This is very important. So we can see them here, second, third, and fourth plantar metatarsal artery. And you need to remember it's the second, third, and fourth, not any other ones, okay? So second, third, and fourth plantar metatarsal arteries are branches from the plantar arch, okay? كده we have the last part of the arteries, which are the anastomosis. Okay, so remember the anastomosis, we said the anastomosis are التجمع حق arteries in one side, or the arteries, group of arteries branch and they supply one area. In case of obstruction of one of the arteries, then there's still blood supply to this area due to anastomosis. Okay, so for this lecture we have two anastomosis. Okay, the first anastomosis is trochanteric, I can't say it, but trochanteric anastomosis and cruciate anastomosis. So these two, اللي هو trochanteric or cruciate anastomosis, we need to see which arteries form the anastomosis, right? So first of all, for both of them, we need to know that these two, the anastomosis, are formed between two branches of the internal iliac and the femoral. يعني الinternal iliac اللي هنا and the femoral are the two arteries that supply or give us branches that form these two anastomosis. تمام؟ يعني أصلهم, the origin of these two anastomosis is from where? Is from the iliac, internal iliac and the femoral artery. Remember that. Internal iliac and femoral artery is the origin for both of the anastomosis. The trochanteric will cruciate. تمام؟ The trochanteric supplies the head of the femur, and we know the head of the femur is a very important site. So the head of the femur is by this anastomosis. What are the arteries that form this anastomosis? عندنا three arteries. The first two are from the internal iliac, which are superior gluteal and inferior gluteal. So عندنا superior gluteal and inferior gluteal. زائد plus what else forms the trochanteric anastomosis? The ascending branch of the medial femoral circumflex artery. Remember here when we said this is the medial femoral circumflex artery, we said it has a transverse branch, anterior branch or ascending branch, and acetabular branch, right? So this ascending branch is gonna form the anastomosis for the head of the femur. تمام? So we have superior gluteal, inferior gluteal, ascending branch of medial femoral circumflex artery. تمام? Then we have the cruciate anastomosis. كده we're done with the trochanteric anastomosis, which supplies the head of the femur. Okay, and we said the origin for the anastomosis is internal iliac and femoral artery. So the branches from these two arteries are the ones that are gonna form these anastomosis. Okay, so second one we said is the cruciate anastomosis. The cruciate anastomosis, where does it lie, or what does it supply? It supplies the back of the thigh. The back of the thigh is by the cruciate anastomosis. تمام? The cruciate anastomosis is formed by four branches. What are the four branches? Let's remember them in a very easy way. Three branches are البروفوندا, خلاص, are from the profunda femoris, and one branch is from the internal iliac. Another way you can remember it is we have one on the top, one branch from the top, one branch from the bottom, and then two branches from the side. So the branch on the top is the inferior gluteal artery. لأنه it's here, صح? So this is the inferior gluteal artery. The branch from below is the first perforating artery. Remember where this is from? It's from the profunda. So here we said first, second, and third. We only want the first. The first perforating artery, which is right here, this is from below. So we said this is from above, and this is from below. What about the sides? The sides we have the medial femoral circumflex and lateral femoral circumflex, which are these two, the pink and blue one. Okay, So an easy way to remember it, we can say ايش cruciate anastomosis is formed by all the branches of ايش the profunda femoris اللي هم medial circumflex, lateral circumflex, and first perforating artery, only the first one, okay? And first perforating artery زائد plus an inferior gluteal artery. So remember, inferior gluteal artery is the artery that shares in both anastomosis, okay? And inferior gluteal is in both. It's in the trochanteric anastomosis and in the cruciate anastomosis, okay? يعني inferior gluteal, we can find it where it's a joker. It's in both of them. The trochanteric anastomosis and the cruciate anastomosis, okay? كده we're done with all the arteries. Now let's move to the veins. Here it is everything we just mentioned and we covered. You can go over these, the clinical application. I'm not quite sure. I don't think we're going to get any questions regarding them. But go over them for your information. Let's go now to the veins. For the veins, we're going to start from the opposite. So we're going to start from the foot and then going up, ascending upward towards the femoral vein and so on. Okay? So let's start أول شيء with the dorsal venous arch. So remember in the upper limb we also had dorsal venous arch, but then كان في الupper limb كان ينقسم إلى cephalic and basilic, right? One is medial and one is lateral. Same idea here. We have dorsal venous arch. Medially is going to continue as great saphenous vein. Laterally it's going to continue as small saphenous vein. Okay? Remember here, this is the fibula, so this is the lateral side, and here we have the tibia, medial side, or also you can see the big toe. تمام? So this is the medial side, and this is the lateral side. تمام? So قلنا medially it's going to continue as the great saphenous vein. Let's go see the great saphenous vein. The great saphenous vein, خلاص we said the origin is the dorsal venous arch from the medial side. تمام? Where is it going to go? أول شيء it's going to go upwards. It's going to ascend upward in front of the medial malleolus. Okay, it's going to go in front of the medial malleolus. And then it's going to continue up. خلاص, all the way in the superficial fascia, all the way to the knee. Once it reaches the knee, it's going to go behind the knee. So these dotted lines means in it's behind, in the posterior side. So we can see here, it's going to go in the posterior side. And then it's going to come back to the anterior side and go in front of the thigh. So let's imagine this is the thigh, for example. So it's going to come here behind the knee and then in the anterior compartment or in the front of the thigh. تمام? Where does it drain? Where does it terminate? Or where does it drain? This is very important. It drains into the femoral vein. Drains into the femoral vein, the one in purple here. Okay, and we're going to talk about the femoral vein in a bit. Just remember for now that the great saphenous vein drains into a femoral vein. تمام? What about its branches? Or in the veins we don't have branches. We have veins that drain into the vein. But I'm going to say branches because it's easier. خلاص? So what are the branches or what are the veins that drain into a great saphenous vein? They're the exact same as superficial branches حقين femoral artery. Remember in the artery here we said we have superficial branches for the femoral artery, which were superficial circumflex, superficial epigastric, and superficial internal pudendal. So these internal pudendal, so the same exact names are just gonna change artery to vein. يعني اللهم just change artery to vein. So the veins that are gonna drain into the great saphenous vein are the superficial circumflex, superficial epigastric, and superficial external pudendal. خلاص? In the arteries, they're gonna branch out or they're gonna come out from when? From the femoral artery. But في الvein, they're gonna drain into the great saphenous vein. Okay? Remember that. في الvein, they're gonna drain into the great saphenous vein. But في artery, they're gonna branch out or they're gonna come out from the femoral artery. Okay? But then we have small saphenous branches behind the knee and perforating veins. Not important, you can skip them. خلاص? طيب. The second saphenous vein is the small saphenous vein, which is gonna go laterally. So we said medial خلاص the great saphenous vein and we talked about it. Now let's move to the small saphenous vein. The small saphenous vein is gonna go where? It's gonna go upwards and lateral malleolus. Okay, so it's gonna go behind the lateral malleolus. So it's gonna go here and it's gonna go behind the lateral malleolus, and then it's gonna continue, but posteriorly. We're not gonna see it anteriorly. And we can only see the beginning of it anteriorly. The rest is gonna continue posteriorly. تمام? So let's go here and see it posteriorly. So we said that the origin is the dorsal venous arch in the lateral side, same as the great saphenous, but the great is from the medial and this is from the lateral. تمام? And we said it's going to go behind the lateral malleolus and continue, it's going to continue posteriorly and it's going to go upward in the middle of the back of the leg. يعني if this is the leg كده, in the middle of the back of the leg, in the deep fascia, that's where it's going to continue. تمام. And where is it going to terminate? This is very important. It's going to terminate عند البوبليتيل vein. So بيطلع هنا كده, بيدخل في الإيش في البوبليتيل vein. It's going to terminate in the popliteal vein, or it's going to drain in the popliteal vein. Okay? And where's the popliteal vein? Popliteal vein اللي هو أخ popliteal artery. نفس الفكرة. خلاص? It's going to go in the popliteal fossa, because the popliteal vein is in the popliteal fossa. تمام? So the termination, or where does the small saphenous vein drain? And the popliteal vein. Okay? What are the branches? The branches are not very important. You can skip them. But veins from the back of the leg, communicating veins with the deep veins, and anastomotic branches that join the great saphenous vein. Okay? You can skip عادي. طيب, let's move to the popliteal vein. Then we said the termination for the small saphenous is the popliteal vein. So let's go see the popliteal vein. Popliteal vein, the origin حقتها a bit different. What's the origin حقتها? Remember the vena comitants? We said that the vena comitants are veins ما عندهم شخصية. We can find them everywhere. And there's a very important feature in them that they're always stuck to an artery. صح? Remember in the upper limb, قلنا vena comitants. Here, we said the vena comitants here in the upper limb are stuck to the brachial artery, right? So, in the lower limb, we have a similar thing. We have two vena comitants. They're stuck to the anterior and posterior tibial arteries. Remember the anterior, posterior here? So, here we said we have anterior tibial artery, posterior tibial artery. Next to them here, we have two vena comitants which are stuck to them. يعني واحدة stuck to the anterior, واحدة stuck to the posterior. These two vena comitants are going to come here and they're going to fuse together or unite together and give us the popliteal vein. So the vena comitants of the anterior and posterior tibial arteries are going to unite and give us popliteal vein. Okay? So this is the origin for the popliteal vein. The origin is the union of the vena comitants of the anterior and posterior tibial arteries. But then where does it terminate? It terminates in the femoral vein. So remember in the arteries, we said that the popliteal artery was originated from where? It's originated from the femoral artery. So here we have the opposite. يعني هناك في الارteries we said femoral artery continues and then it terminates into popliteal artery and continues as popliteal artery. Here it's going to be the opposite. The popliteal vein is going to terminate into the femoral vein because we're going upwards. في الارteries we're going downwards. في veins we're going upwards. So the popliteal vein is going to terminate into the femoral vein where at the adductor hiatus, same exact place where the femoral artery اتحول إلى popliteal artery. When we said the femoral artery changed to popliteal artery, we said it was where? It was at the adductor hiatus. So the same exact site is going to be for the veins. The popliteal vein is going to change into or terminate into femoral vein at the adductor hiatus. Okay? What are the branches? First branch, not very important, veins that accompany the arteries. Skip. بعدين عندنا small saphenous vein. This is considered one of the veins that drain into the popliteal vein. So remember, the popliteal vein has one main vein that drains into it. اللي هي a small saphenous vein. But then it has other small veins and هما veins accompanying the arteries. Okay? But the small saphenous vein is very important لأنه أصلا the termination for the small saphenous vein is the popliteal vein. So they're related together. Okay? Now let's continue and talk about the femoral vein. Since we said the termination for the popliteal vein is femoral vein, صح? So it's gonna start from the posterior because obviously the popliteal is in the posterior and it's gonna terminate into femoral. So أول ما it terminates into femoral artery, it's gonna go back anteriorly. Okay, so let's go here and see the femoral vein. So the femoral vein here, we know this is the posterior side. That's why it's dotted. So the posterior we have the popliteal vein. But then it changes into femoral vein and then it comes anteriorly. Okay, once it comes anteriorly here, we know that the origin is a continuation of the popliteal vein where at the adductor hiatus, and it terminates where? It terminates into the external iliac vein. Remember in the artery we said the femoral vein originates from the external iliac artery. Here, this is the femoral artery. The femoral artery originates from the external iliac artery. صح? So في الvein نفس الشيء بس بالعكس, opposite thing is gonna happen. The femoral vein is gonna terminate into external iliac vein. Okay? where at the mid-inguinal point, exactly the same as the artery. يعني the veins are a repetition of the artery but in the opposite direction. خلاص. So if you remember the artery خلاص you're going to be able to remember the veins in the opposite direction. تمام. So here we said in the artery we said external iliac artery is going to terminate into femoral artery where at the mid-inguinal point. Remember هنا قلنا we draw the line and we're gonna this is the mid-inguinal point. Same thing at the same point here. The femoral vein is gonna terminate or change into external iliac vein. تمام. طيب what are the branches of the femoral vein, or which veins drain into the femoral vein? We have 4 veins. خلاص. First of all we mentioned the great saphenous vein, which is the first one. قلنا it drains into the femoral vein, right? So this is the first one, great saphenous vein. بعدين we have ايش؟ profunda femoris. Remember profunda femoris في الارتري نفسها هنا في الفين. profunda femoris vein. This is the second one. It's the one in green here. It's gonna drain into ايش؟ the femoral vein. Then we have the same برضو, the same branches of the profunda femoris. Remember in the artery we had the branches of the profunda femoris, which were ايش؟ medial circumflex femoral and lateral circumflex femoral. In the veins we have the same thing. Profunda femoris vein, the lateral femoral circumflex or circumflex femoral نفس الشيء, and medial femoral circumflex are both gonna drain also in the femoral vein. يعني we can just say that the great saphenous vein and the profunda and its branches are all gonna drain into ايش؟ الفemoral vein. تمام. The last thing we need to know for the veins are which veins are superficial and which veins are deep. Remember in the upper limb قلنا ايش؟ We said in the upper limb all the veins are superficial except for 2, which are the axillary vein and the vena comitans. Here we have the opposite. All the veins are ايش؟ are deep. اللي هم popliteal vein is deep. The vena comitants are deep. The femoral vein is deep. All of them are deep except for ايش؟ the saphenous. So remember saphenous اللي هم great saphenous and small saphenous SS. So superficial means ايش؟ saphenous. خلاص على طول. Superficial veins saphenous اللي هم great and small saphenous. Okay? So in the upper limb the majority is superficial veins and we only have 2 deep. في lower limb we have the opposite. We have ايش؟ all of them are ايش؟ deep except for the saphenous. The great and small saphenous are ايش؟ are superficial. Everything else is deep. تمام. So كده we're done with the lecture. Make sure you go over the clinical application, the one in stars, and the case scenarios, and good luck.